Good morning. So, not a huge crowd today. We'll keep it short. So basically integration of the supply chain and serialization, well, that's the first real step into really integrating the supply chain. We had a good example of this earlier. I'm going to go a bit more into that detail from the data perspective today. First, couple of words about us. We are part of NNIT. NNIT, that's a global consultancy with more than 1,700 people worldwide for the life science industry. Excelis, where we are coming from, we were the leading consultancy specialized on serialization and supply chain, and we have been acquired a few years ago. So now we are part of the range of services that goes from first-timer launch support to Viva Powerhouse, global serialization, MES implementation, validation, and of course AI, more and more. Our services, from our part, are centered around data in the supply chain, data in the serialization, compliance, helping companies with the different compliance mandates worldwide, with the strategy, with the health check to reassess the strategy after so many years of working. It's often very useful to go to the next stage of the digitalization of the supply chain. And also, we do provide all the managed services related to running the show. Now, coming into the subject, we are living in a world in movement. We saw it with the perfect example of the Chinese that was detailed earlier. We have many different serialization mandates from different level of complexity, from point to point, to those involving all the different stakeholders in the supply chain. We do also have more and more countries that are coming with serialization mandate. The only thing that they have in common is to be different than the next one. And that creates somehow a chaos, or at least an extra complexity in the way to handle this. But also, we do have things like AI, data, the need to have more and more data. Everybody is talking about AI. Christophe was reminding me yesterday that how fancy AI is, still subject to the same old axiom: garbage in, garbage out. AI will be only as good as the data that it can reach, as the quality of the data that it can reach. And this is really a problem today. And also, we do have that, what we can call the connected consumer. Basically, you and me and the people in China who like to see information at their fingertip on the product that they are taking for their health. They want to know, people want to know about the traceability of the product, want to make sure that the product has been handled in the right conditions coming to them, and there is a growing push from the public for that. And the industry will need to meet that demand. I've been speaking with quite a lot of supply chain leaders on what are the challenges, what are the key things that are important for them. And if I'm trying to isolate just a few that are coming the most often, you will see, with no surprise, the complexity of the regulatory mandate. Yes, it's a strain. Well, that's the cost of doing business in the pharma industry to some extent, but still, it's a strain. And as we said, more and more countries and smaller countries are coming with complex serialization mandate, to the point that the question often asked is, well, is it becoming too costly to be compliant to access that market for a small volume? And that's really a bad question to ask. It's because it's a super difficult question. Basically, are we going to stop helping people in that country because suddenly money is not there? That's a problem. The lack of visibility in the supply chain comes often and often and often. And it is a problem. Of course, it is a problem because the supply chain, especially in Europe, is very fragmented. We know that. But yes, that's also leading to inefficiency of the processes. A lot of the processes are still manual or still not outdated. That's not a question of fashion, but are still lagging behind. And of course, there is the growing threat of counterfeiting. It's there, it continues to push silently. We may not see it directly in Europe because of the EU FMD also, that has been, as many people believe, pushing the counterfeited product out of the legitimate supply chain, which is on a tighter control outside, but still there. And also, beyond the counterfeited, there is still the diversion of the product. Where are the products going? Are they going in the right place? And that's a problem. It's a problem when we are talking about shortages. And shortages, that's one of the hot topics for the industry right now. So, what could be a secure supply chain? Well, a supply chain that ensures product authenticity, traceability from production to the patient, but also availability for the patient. That's number one function. But also an interconnected, transparent supply chain that will allow the exchange of information. And that's where digitalization comes in, and digitalization can do a lot of things, and we can apply models to a lot of different topics, but let's focus on the most important one, visibility through the supply chain, because from visibility we will be able to enable efficiency and agility in the supply chain. And the challenges are many. The supply chain partners are lacking into EDI readiness. The cost and the timeline of integration has been a huge roadblock, especially when we are talking point by point. Typically, all the companies have integrated 1, 2, 3 external partners, and then they are stopping them. The big ones are integrating the first 5, and that's a real effort. And they are not going beyond that. They are not going beyond that because not only the cost of it is too expensive, but the time to do it in terms of resources also is too important. That's something that needs to change. And silo, when the information exists, it exists in different control towers. And during the last years, we have been talking about control towers in and out. Now, yes. It's like Manhattan, there are so many towers, you don't see the sun anymore. And where is the data? How can you access the data from the enterprise point of view? How can you make sure that this data is available for you to take the right decision? Coming back to the supply chain, I like that model, just one of them, but we are focusing on the enable function. Yes, there is a product flow, source, make, deliver, return, the finance, but the enable function for us, this is providing the backbone for the supply chain processes to support the supply chain flow. And the question is how to get to the next level. And to go to the next level, that's by integrating the different supply chain partners into the network. And that starts now That already started many years ago, but it needs to accelerate. There are different networks in that supply chain, in that pharma supply chain, but let's focus on what is within easy reach, the manufacturing CMO network and the distribution center 3PLs. Those are the ones that needs to be integrated in priority. Those are the ones that need to be feeding and exchanging securely information with the MAH. And then we will be able to go down to the, ultimately to the patient, to the point of dispense. But integrating the first two is key. It's all about data anyway. Data that makes sense, data that can be trusted, that can be exchanged, and that is secured. That means having the right processes and setting up the right exchange method, whatever they are. They are not, we have been talking about EDI for what, 20 years? There is nothing super new around that. Yes, there are maybe smarter ways. And EDI will be fantastic, but EDI is still not implemented in the pharma supply chain, and that's really a shame. The goal is to be able to feed that data to the ERP of the MAH so that it can access, it can be sent to the right functions. And it starts by, so the exercise starts by understanding your own supply chain and reviewing where you stand on that, where does your data go, what are you exchanging with your different partners, but also with the first questions, who are your partners? And many pharmas, within many pharmas, that's a difficult question, still today. And we are approaching this with what we call our 4-dimension maturity approach: processes, technology, data, collaboration, integration capability of the partners. And this is something that we kept very simple but very effective on assessing and ranking all the different partners. I wanted to share again with you something that did happen in Spain. That's a live example that was in the news. That's an excerpt of a newspaper from Spain from last year. One of the leading distributors in Spain has been hacked. They could not access their data for 3 weeks. What did happen? The products were perfectly fine. The data could not be accessed. The products were not moving, were not reaching the pharmacies, and it was creating really a strain on the patient. And this is so important to understand that we are living in a new paradigm. This is the supply chain for the pharma industry. It's not about moving boxes. It's about moving products that are boxes and data, and guaranteeing the integrity of the data product data boxes through the whole chain. And we spoke, that was also with your question of people who have been taking bottles, refilling them. Well, first those bottles, to refill them, maybe they were already dispensed, so the data will have been triggered somewhere, but also, yes, there was a physical element. So it's really mixing both the physical world and the data world, not one without the other. And actually, the cyber attack, yesterday I was coming from Brussels. We had quite a lot of delays because of that also with the airport. And that's becoming a threat more and more. And especially for the pharma industries, the hospitals have been under that. The MAHs, most of them are very well equipped against that. they have been raising their shield and they have been preparing against that. But if you think that the 3PLs and the CMOs are, think twice, or at least check it. And that's the purpose of the what we call the supply chain health check, to understand your supply chain, to review your different partners, and to better understand their capability to handle the data for you. Of course, a lot of different, several different key basic elements, but how able will they be to follow your processes, secure your data, augment your data, and export your data back to you or to the next in line. And this is really a weak point today in the pharma supply chain. And it's important to assess your network and to have a strategic review of the different tasks to take to bring them up to date. So that's the last slide. The takeaway from what we can say, transparency, efficiency are the key to the evolution of the supply chain. We are talking about maybe the revolution of AI, but again, I like to, what we're talking here about, it's the basics, that's the foundation that will feed the next steps. So, evolution, know your supply chain, understand data and transformation. Data is at the center of the digital effort. And I know that there is in the industry this kind of expression of digitalization fatigue, but also serialization fatigue. I see that in many, many companies where there is this serialization fatigue, where the management believed, actually most of them believed, that February 2019, they were going to assign the team somewhere else. We are many years after, and still it is major activity. And actually, what many people in the companies at the management level don't understand well enough is that serialization is mission critical. Without serialization, the product is not moving. Serialization doesn't work today in the company, products are not moving. So it's important to understand your partner, create the right network with your partners. And the call of action, yes, do the assessment of your supply chain. That was my presentation today.